my name is Ingrid and I'll be your nurse today. Can you confirm your name and date of birth for me, please?
Kathy Matt, 4/16/51.
All right, I'm gonna check that with your bracelet. And that's right. And do you have any allergies?
No.
All right, so I have an order from the doctor today to perform a full assessment. Is that all right with you?
Yes.
All right, I'm gonna first start by taking your vitals. I have my thermometer here, and I'm gonna go ahead and take your temperature. And it's 99.2. And then I'm going to go ahead and get your pulse. Let's see. All right, 72. And then I'm going to take your blood pressure. And have you had a mastectomy or any lymph nodes removed on either
Yes,
side?
no. Yes, on the left side.
On the left side. So we need to do your blood pressure on your right side,
Yes,
correct?
correct.
Okay.
Yes.
All right. Artery. There we go. Okay. And what is your usual blood pressure, if you know?
I don't know.
Okay.
They always say it's good though.
Okay.
And they did take it.
All right. 118 over 60, which is good. And your respiratory rate was 14. Your pulse ox. Can I see a finger, please? Thank you. All right. 97. Okay. Next, what would you say your height is?
5 feet,
And what would you say an average weight is?
about 142.
Okay, here we go. So I obtained a full health history of my patient by asking her questions. All right.
Yes.
All right. And next, I'm going to go ahead and assess your skin. So I'm going to assess her skin for color, temperature, temperature, texture. So her skin is warm, it's pink, it's dry, intact, there's no lesions, no echymosis. Assess. All right. And then next, I'm going to go ahead and I'm going to go assess her hair for texture, for color, and I'm also going to assess her scalp for any lesions or anything that may be present. She does not have any. And next, I'm going to go ahead and assess her face for symmetry, as well as shape. And her face is symmetrical, it's round, her eyes are both symmetrical. And can you go ahead and smile for me? Can you puff out your cheeks? And then raise your eyebrows. Okay, next I'm going to go ahead and assess your hair for distribution. So your hair is equally distributed throughout your head. And then it's also equally distributed on your body, also in your eyebrows. And then I'm going to assess for any bruising, lesions, dehydration of your skin. And I'm going to go ahead and assess your skin turgor. So I'm going to go ahead and it goes right back. So you have good skin turgor, which would be an indication of dehydration, or could be a possible indication of dehydration. And then I'm next going to assess her nails. So I'm going to assess her nails for skin, for color, for texture, and I'm also going to assess her cap refill, which is within 2 seconds, which is good on all digits. And her nails are pink, and they're pink, they're intact, and they're smooth in texture. So, all right, so now I'm going to do an eye assessment. So first I'm going to go ahead and test your distant vision. So I have a Snellen chart here, and what I'm going to do is I'm going to stand 20 feet away from you, and what I'm going to have you do is I'm going to have you cover one eye and then read the smallest print that you can, and I want you to read the whole line, and then we're going to go ahead and repeat the process with the other eye, okay? Okay, all right, so I'm going to go ahead and stand 20 feet away, and have you read the smallest line that you can.
PECFD.
All right, and she read the 5th line, which is 2040. So what she can read at 20 feet is what most people can read at 40 feet. And then we're going to go ahead and repeat the process.
TOZ.
All right, and she read 2070. So what she can read at 20 feet is what most people can read at 70 feet. And what we're going to do is now we're going to do it with both eyes.
TECFD.
All right. And she read the 5th line, which is 2040. So what she can read at 20 feet is what most people can read at 40 feet. So next we're going to go ahead and test your distance vision. Or not distant vision, your near vision. So I have this is called the Jaeger chart. And what I'm going to have you do is I'm going to have you hold it at, excuse me, I'm going to have you hold it at arm's length. And what I'm going to have you do is read the smallest print that you can with one eye, and then we'll switch.
Able Treaty the restitution of the standards and prisoners which had been taken in the defeat of Crassus, whose generals in the early part of his reign attempted the reduction of Ethiopia and Arabic Felix. They marched near 1,000 miles to the south of the tropic. I'm to the next one. I read this.
All right, perfect. So she read number 7, which is 1.50 meters. And then I'm going to have you repeat the process with the other eye. And I'll have you read it at arm's length.
Attack, they seem to something to the weight of the Roman power. They soon by the signal.
Perfect. And then she read number 11, which is 2.50 meters. And now I'm going to have you read it with both eyes.
Able treaty the restitution of the standards and prisoners which had been taken to the defeat of Crassus, his generals in the early part of his reign attempted the reduction of Ethiopia and Felix. They marched near 1,000.
Perfect. And then she read number 7, which is 1.50 meters. So next, I'm going to go ahead and test your peripheral vision. So what I'm going to have you do is I'm going to have you stand up. I'm going to have you turn around, and what I'm going to do is I'm going to go ahead and wiggle my fingers, and I want you to tell me when you can see them.
I can see the left, see the right.
Perfect. All right, so you can go ahead and sit down.
Thank you.
So next what I'm going to do is I'm going to test your corneal reflex. So I have a cotton ball here, and what I'm going to do you wear contacts?
No.
Okay. So if she wore contacts, her corneal reflex could be diminished because people who wear contacts are constantly putting things in their eye. But as you don't, you can have a regular reflex. So what I'm going to have you do is I'm going to take your glasses off. And what I'm going to do is I'm going to put this cotton ball up near your eye. And I'm going to repeat the process on both sides. All right. And she has a strong corneal reflex. And then next, I'm going to go ahead and assess your pupils. So I'm going to use PERLA, which stands for pupils are round, reactive to light, and accommodation. So what I'm going to do is I'm going to go ahead and shine my pen light in your eye. I do apologize, it is bright. So I'm going to shine it in your eye for just a second.
This one.
All right. And her pupils are both round. They are reactive to light. And then next I'm going to test for accommodation. So what I'm going to have you do is I'm going to have you your eyes follow my pen light to your nose. All right, and her eyes have accommodation. So next what I'm going to do is I'm going to test your corneal light reflex. So what I'm going to do is I'm going to take my pen light, I'm going to shine it on the side of your eye, corneal light reflex. And I'm going to shine it on the side of your eye, and I'm going to see if that reflection is in your other eye. It is on both sides. Perfect. Next, I'm going to go ahead and assess your sclera. So I'm going to assess your sclera for color, if there's any veins present, and if there's any discharge, which there's no discharge. I don't see any prominent veins, and it is white. And then I'm going to I'm going to use my pen light again, and I'm going to go ahead and assess your corneas. So with your corneas, I'm going to look for transparency, if there's any discharge present, and surface characteristics. So your corneas are both clear, and they're rounded, and there's no lesions or anything present on them. And then next I'm going to go ahead and assess your iris, and I'm assessing your iris for shape, for symmetry, for color, and your irises are both round, they are both blue, and they are symmetrical on both sides, and they're smooth in their characteristics. And then next I'm going to test your 6 cardinal fields of gaze. So what I'm going to have you do is I'm going to have you follow your eyes to my pen light. Alright, and both of your eyes moved equally. And then next I'm going to test your red light reflex. And what I'm going to do is I'm going to take my ophthalmoscope and I'm going to shine a light in your eye, and I'm going to see if that red light reflex is present in both eyes. I'm going to go ahead and shine my light, and it is present in both. Alright, so next I'm going to assess your conjunctiva. So what I'm going to have you do is I'm going to have you take your finger and pull down your eyelid on both sides. Alright, perfect. And then I assess that for color, which is pink. And then if there's any discharge, there was no discharge present. And then for moisture, and both your conjunctivas are moist. And then next we're going to perform the cover-uncover test. So what I'm going to have you do is I'm going to have you take your hand and put it over your eye and then remove it. And then we're going to repeat it on the other side. Alright, perfect. And your eyes did not move, which is the appropriate finding. And then next, I'm going to go ahead and I'm going to palpate your eyebrows, your eyelids, and your eyelashes. And, well, first I'm going to inspect them before I palpate them. So I'm going to inspect them for equal hair distribution, and then for symmetry, if there's any lesions present, and then color. And there's equal hair distribution in your eyebrows as well as your eyelashes. They are both symmetrical, and they are of the appropriate your hair color is the same as the hair on your head, and then your eyelids are the same color as the rest of your skin. So if I could have you take your glasses off, and I'm going to go ahead and palpate those. Alright, and I don't feel any lesions or any masses or anything. Go ahead and assess your hearing. So I have a couple tests of what I'm going to do, so if you could stand up for me, please. And what I'm going to do, it's called the finger rubbing test. So what I'm going to have you do is I'm going to have you close your eyes, and I'm going to rub my fingers, and I want you to tell me if you can hear it.
Oh, okay.
So go ahead and close your eyes.
Yes. Yes.
Okay. And the next test is called the whisper test. So what I'm going to do is I'm going to stand behind you, and I'm going to whisper a word, and I want you to repeat the word if you hear it.
Okay.
Okay.
I can hear. Purple? Green.
Okay, perfect. The next test is called the Weber test. And what I'm going to do is I have my tuning fork here. And what I'm going to do is I'm going to put that in the middle of your head. And I want you to tell me if you can feel vibrations on both sides.
Yes.
Okay. The next test is called the Renee test. And what I'm going to do is I'm going to take my tuning fork and I'm going to put it back here on your mastoid. And I want you to tell me when you stop hearing or stop feeling the vibrations. And then I'm going to put it up to your ear and I want you to tell me when you stop hearing the vibrations. I'm going to have you count to 12.
Okay. Okay.
Okay. So that was 6 and 12. So it should be a 2-to-1 ratio, which it was. And then we're going to do the other side.
Okay. Okay.
All right, and that one was also 6 and 12, so it was a 2-to-1 ratio. And then next, what I'm going to do is I'm going to look inside of your ears. So I have my otoscope here, and I'm going to go ahead and shine the light, and I'm going to look inside your ears, looking through your external auditory meatus into her tympanic membrane. So I see her tympanic membrane. It is a grayish color, which is what we want. I'm going to go ahead and look at this one. And there is some earwax present in both ears. It is a moderate amount of earwax. And then next, I'm going to go ahead and I'm going to palpate her earlobe for texture, for any lesions or anything, and there are no lesions present. I'm going to do that on the other side. And I'm also going to inspect them for shape, alignment, color, and surface characteristics, which they're pink, they're intact, they're dry, and they are aligned with the external campus of her eyes. Then I'm also going to assess her hearing that is appropriate for conversation, which it is. So she's responding to my questions immediately, and she's not asking huh or what. So her hearing is appropriate. And then next, I'm going to go ahead and assess her nose. So her nose, I'm first going to inspect it for color, for that it's midline with her face, and then I'm going to go ahead and palpate her nose for its surface characteristics, that there's no lesions or anything else, which there's not. And her nose is pink, it's intact, it's dry. And then I'm also going to look in her nasal mucosa. So I'm going to look inside of each nair, and what I'm going to do is I'm going to shine my pen light, and I'm going to look inside of your nose to see if there's any mucus present and for intactness and different things. So I'm going to go ahead and look inside of her nose, and it's pink, it's intact, there's no mucus, there's no lesions, there's no foreign bodies, and it is moist, which is good. There is some nose hairs present as well. I'm going to palpate her frontal and maxillary sinuses. So,
Okay.
I have 2 smells. What you're going to do is you're going to cover your eyes, and you're going to cover one nostril with a finger, and then I'm going to have you smell, and I want you to tell me what the smell is. So close your eyes,
Oh, yeah. Oh, yeah.
and then put one finger on your nose, and then I want you to tell me what the smell is.
Tell me when. Ooh, garlic.
All right, and then I'm going to have you switch. So I'm going to have you put the other finger on your nose, and I want you to tell me what the smell is.
Oh, cinnamon.
Perfect.
Much better, yes.
So now I'm going to go ahead and assess your nose for patency. So what I'm going to have you do is I'm going to have you, again, put one finger on a nostril, and I want you to sniff in. All right, and do it down the other side. Perfect. And then I'm also going to assess her nose for symmetry.
All right, so next I'm going to go ahead and assess your lips. So what I'm going to assess for color, for shape, symmetry, and texture. So your lips are pink, they are symmetrical on both sides, as well as they are smooth. There's no dryness or anything. And what I'm going to have you do is I'm going to have you smile. I'm going to have you puff out your cheeks. Perfect. And I'm testing for facial muscle symmetry as well. And next I'm going to go ahead and assess your teeth, your gums, your buccal mucosa, as well as your tongue. So what I'm going to have you do is I'm going to have you open your mouth, and I'm going to assess your teeth, and you do not have any missing teeth. Your tongue is pink, it is smooth, your buccal mucosa they are pink, they're moist, and do you have any tonsils?
No.
Okay. So next what I'm going to do is I'm going to inspect your pharynx. So what I'm going to do is I'm going to shine my pen light, and what I'm going to have you do is I'm going to have you stick your tongue out and say, ah. All right, perfect. And then I was also assessing her soft and hard palates, and her palates moved, which is appropriate. And then what I would do next is I would go ahead and don exam gloves, and what I would do is I'd go ahead and palpate your teeth and gums and make sure there's no foreign bodies or lesions present on those, and as well as your buccal mucosa and your tongue as well. And I would palpate your tongue for texture, and I would want to feel the taste buds on your tongue. And then next I'm going to go ahead and assess your tongue for taste. So what I would have you do is I would have you taste 4 different things that were sweet, salty, savory, or bitter, or sour and bitter. And then I would also test your gag reflex as well to make sure that that wasn't. Next, I'm going to go ahead and assess your neck. So I'm going to go ahead and assess your neck for position, so it is midline to your body, and then I'm going to go ahead and assess it for surface characteristics as well, and it is pink, intact. I don't see any lesions or any masses or anything. And next I'm going to go ahead and I'm going to palpate your neck. So I'm going to palpate for your trachea. So I'm going to go ahead and palpate for your trachea, and it is midline, it is slightly movable. And next I'm going to palpate for your thyroid. So what I'm going to have you do is I'm going to have you go ahead and swallow. All right. And then I assess that for size, which it is small, and it is midline, as well as I don't feel any enlargement. Next I'm going to assess your range of motion of your neck. So what I'm going to have you do is I'm going to have you rotate your neck. Then I'm going to have you go up and down, and then I'm going to have you go shoulder to shoulder. Perfect. And you have full range of motion of your neck. And then next I'm going to go ahead and test the strength of your sternocleidomastoid mastoid, which is the muscles in your neck. So what I'm going to do is I'm going to place my hand on one side of your face, and I'm going to have you push against it, and then we'll repeat the process on the other side. Perfect. Perfect. And you have your neck it is strong. And then next I'm going to go ahead and test your trapezius, which is your shoulder muscles, and I'm going to put my hands on your shoulder, and I'm going to have you lift your shoulders up. Perfect. And that muscle strength is also strong. All right. Next, I'm going to go ahead and assess your carotid arteries for amplitude. So I'm going to go ahead. All right. And I would rate both sides a +2. And the next what I'm going to do is I'm going to auscultate for bruits. So what I'm going to do is I'm going to take my stethoscope, and I'm going to listen to your carotid artery. So I'm going to go ahead and switch my stethoscope from the diaphragm to the bell, and I'm going to go ahead and listen for bruits. All right, and I do not hear any bruise. And then next, I'm going to assess your jugular vein for pulsation. And I do not see any pulsation of your jugular veins on either side. Next, I'm going to go ahead and palpate your lymph nodes. Have you had any lymph nodes removed in your neck?
Not in my neck, no.
Okay, so I'm going to go ahead and palpate them for size, consistency, and if they're movable. Alright, and I did not feel them, so they are small. I did not move them, so they're small, and if I did feel them, they should be small, slightly movable, and small and slightly. So next I'm going to go ahead and assess your upper extremities. So what I'm going to do is I'm going to inspect your shoulders as well as your upper chest and arm areas, and I'm going to assess that for contour, for shape, for symmetry, and for height. So your shoulders are of equal height and they are symmetrical. Your arms are both of symmetrical length and of symmetrical size. And then next I'm going to go ahead and palpate them for muscle mass as well as for contour as well. So I'm going to go ahead and palpate them. And they are symmetrical. They have equal muscle mass on both sides. And then next I'm going to go ahead and assess the strength of your upper extremities. So I'm going to go ahead and assess the strength of your upper extremities. So what I'm going to have you do is I'm going to put your arm up, and have you push against my arm, then pull. Alright, and the other side, push, and pull. Alright, and then I'm going to have you squeeze my hands. Good. Alright, and then we're going to assess the range of motion of your shoulders. So I'm going to have you abduct, and then adduct, abduct, and adduct. Perfect. And then I'm going to have flexion and extension, flexion and extension. And next I'm going to go ahead and assess your joints for symmetry, and then I'm going to go ahead and palpate them. So I'm going to go ahead and palpate your elbows. Do you have any pain?
No.
Alright. And then I'm going to go ahead and assess your wrists. Do you have any pain?
No.
And then she has all 10 digits. And then I'm going to test the range of motion of your elbows. So what I'm going to have you do is I'm going to have you do supination and pronation, and then supination and pronation, and then I'm going to have you do your wrists. So what I'm going to have you do is adduct and abduct, and then I'm going to have you flexion and extension, and then have you rotate them. Perfect. And then rotate the other way. Perfect. And then are you able to take your fingers to all? I'm going to go ahead and palpate your epitrochlear lymph nodes, which are the ones that are under your arm. And have you had any lymph nodes removed?
Yes.
On which side?
The left side.
The left side. Okay, so we're going to go ahead and palpate the ones on the right then. So what I'm going to do is I'm going to go ahead and palpate your lymph nodes. And if I did feel them, it would want them to be small and slightly movable, but I did not feel them. And then next, what I'm going to do is I'm going to go ahead and assess your pulses. So I'm first going to start with your brachial pulse, and then I'm going to assess your radial pulse as well for amplitude. So I'm going to go ahead and assess. Alright, and then the other side. Alright, and I would rate all of those pulses a plus. Next, I'm going to go ahead and assess coordination of your upper extremities. So I'm going to do two tests. The first one, what I'm going to have you do is I'm going to have you rapidly put your fingers to your thumb on both sides. Perfect. And then next what I'm going to have you do is I'm going to have you take your finger, you're going to put it to your nose, and then you're going to put it to my finger. Alright, and then we're going to do it on the other side. Perfect. Okay, next I'm going to go ahead and test your sensory. I'm going to do some sensory tests. So the first one, what I'm going to have you do, so I'm going to have you close your eyes for these. And what I'm going to do is I'm going to do it's light touch. So what I'm going to do is I'm going to take a cotton ball and I'm going to touch your arm, and I want you to tell me if you can feel it and where you're feeling it at.
Okay. Here, on my finger, on my wrist,
Which side?
right.
Okay.
My left shoulder,
Alright.
my left arm, my right upper arm.
Perfect. I'm going to go ahead and test your sharp versus dull sensation. So what I'm going to have you do is I'm going to have you close your eyes, and I want you to tell me if you feel something sharp or if you feel something dull.
Dull, sharp, sharp, dull, sharp.
Alright, perfect. And then next I'm going to go ahead and do the cyanosis test. So what I'm going to do is I'm going to place two common objects in your hand, and then I want you to tell me what they are.
A ring.
Yep.
Oh. Coin.
Mm-hmm.
Coin. And a ring.
Perfect. Alright, what I'm going to do is vibration sensation, and what I'm going to do is I'm going to take my tuning fork and I'm going to put it on your elbow, and I want you to tell me if you can feel the vibration. So I'm going to have you close your eyes.
Yep, I feel it. I feel it.
Perfect. And then next what I'm going to do, it's called 2-point discrimination. So what I'm going to do is I want you to tell me if you can feel 2 points or 1. So I'm going to go ahead and roll up your sleeve, and I'll have you close your eyes. And I want you to tell me if you can feel 2 or 1.
1. 1. 2. 2.
Alright,
Oh, I
let's
see.
do it on the other side.
1. 1. 2.
Alright. And then next what I'm going to do called extinction. So what I'm going to do is I want you to tell me when you feel 2 points down to 1 point. I'm going to do it on your arms again.
Yeah. Okay. 2. 1. 1.
Okay. We'll do it on the other one.
1. 1. I feel 1.
Alright.
Okay.
And then next what I'm going to do is the graphication test, which what I'm going to do is I'm going to draw a number or a letter in your hand, and I want you to tell me what it is. So you close your eyes.
8.
Alright, and the other one.
8.
Alright, then the last sensory test is called point location, so I'm going to touch a point on your body, and I want you to tell me where I'm touching. So I'm going to have you close your eyes.
Hand. Shoulder.
Alright, so now I'm going to assess your upper extremities for deep tendon reflexes. So I'm going to start with your brachial. So I'm going to go ahead and put my thumb right here in your brachial and tap. And on the other side.
Yeah.
And then I'm going to go ahead and assess your triceps. And on the other side. The last one I'm going to do is your brachioradialis. Other side. So next I'm going to assess your posterior lungs. So what I'm going to do is I'm going to have you stand up. And I'm going to have you face the wall. So I'm going to go ahead and assess her posterior lungs or her back. Her posterior thoracic area for shape, symmetry, so it is symmetrical, and then also for scapular placement, which her scapulas
are in the appropriate placement. And what I'm going to have you do is I'm going to have you take a deep breath, and I'm going to assess for chest expansion. Perfect. And then I'm going to go ahead and palpate your back for muscle definition, as well as if there's any pain or tenderness. Do you feel any pain or tenderness?
No.
Any pain or tenderness?
No.
Any pain or tenderness?
No.
Okay. And then next, I'm going to go ahead and auscultate your back, and I'm going to have you take some deep breaths. And one more. Perfect. Her lung sounds are clear. She has regular rate. And she has symmetrical chest expansion. Next, I'm going to assess for fremitus on your posterior thoracic. So what I'm going to do is I'm going to place my hands on your back, and I'm going to have, I say 99, and I want you to repeat that. 99.
99.
And again.
99.
And one more time.
99.
Perfect. And I felt vibrations in all 6 places,
Okay.
which is important. And next I'm going to go ahead and assess your anterior chest. So what I'm going to have you do is I'm going to have you take a deep breath. Perfect. And you have symmetrical chest expansion. And then we're going to repeat the fremitus again. So I'm going to go ahead and place my hands on your chest, and I want you to say 99.
99.
One more time.
99.
Perfect. And I felt vibrations on both sides. And next I'm going to go ahead and palpate your anterior muscles for symmetry and for muscle tone. And do you have any pain or tenderness?
No.
Okay. Next I'm going to go ahead and listen. So I'm going to have you take a deep breath. And one more time. And one more time. And one more. Perfect. And she has clear lung sounds as well. So next I'm going to assess for your anterior posterior lateral diameter. So what I'm going to do is I'm going to measure from the edge of your chest to your back, and then I'm going to have you turn around, and then it should be half what it is of your back, and it is. And if it wasn't, it could show barrel chesting. And then next I'm going to go ahead and locate your apical pulse, and then I'm going to go ahead. I'm going to go ahead and assess your apical pulse. So what I have you do is I'm going to have you go ahead and sit down. And if you could lay down. So to find the apical pulse, what I'm going to do is I'm going to find the 5th midline intercostal space, and then I'm going to listen there. And that is on the left side. So I'm going to go ahead and find the spaces, 1, 2, 3, 4, and 5, and usually it's right under the left wrist. And then I'm going to go ahead and auscultate that for a minute. All right, and your apical pulse is 80, which is good. And then next, I'm going to go ahead and listen to your heart as well. So I'm going to go ahead and auscultate. right. And I don't hear any murmurs or any sloshing. And then also with your breath sounds, there was not any bronchi, wheezing, or rales present as well. And you can go ahead and, well, you might as well lay down because I'm going to go ahead and assess your abdomen next.
Yeah.
So what I'm going to do is I'm going to go ahead and first inspect your abdomen. So I'm going to inspect for shape as well as if there's any ecchymosis present, which is bruising. And then if you had any drains or anything present, which you don't, and your skin is intact, it's dry, and there's no ecchymosis present. And then next I'm going to go ahead and auscultate. So I'm going to listen to all 4 quadrants for vowel sounds. All right, and you have active vowel sounds in all 4 quadrants, which is good. So next I'm going to go ahead and palpate your abdomen, and I want you to tell me if you have any pain or tenderness. Do you have any pain or
No.
tenderness?
No. 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 No.
All right, perfect. And your abdomen is soft, it's non-distended, which is both good. All right, so now you can go ahead. All right, so along with your abdominal assessment, I would go ahead and assess in your inguinal region for your femoral pulses. So what I would do is I would go ahead and assess those, and a expected finding would be that those would be a +2. And then I'd also go ahead and assess and palpate for your inguinal lymph nodes, and we want those if we can feel them. We want them to be small, slightly movable, and round. But an expected finding would be that I wouldn't feel those. All right, so next I would go ahead and assess your breasts. And have you had a mastectomy?
Yes.
Okay, and on which side?
The left.
The left side. Okay, so an expected finding for assessing the breast, we're assessing for size, color, shape, and surface characteristics as well. So we want both breasts to be of similar size. It is normal for women to have one breast that is bigger than the other. And we also want those to be pink, dry, intact, and then we also want them to be round. And then we want them to be smooth. We don't want any dimples. Next on your breast, I would go ahead and assess your areolas. So your areolas should be round, they should be pink in color, and they may have small bumps on them, which is normal. And then I would also assess, and they should be of similar size. And then I would also want to assess your nipples as well, and they should not be inverted. And if they were inverted, I would ask you if this has always been that way or if this is a new finding. And then if it was a new finding, we'd report it to your primary care provider. And then I would also assess for discharge if you have any discharge. A patient that may have discharge would be a woman who's lactating. And then also I would assess it for size, for consistency, and for symmetry on both sides. And then I would also assess your breasts for lateral pull. So what I would have you do is various positions. So I'd have you put your hands above your head and then on your hips and then lean forward to make sure that your breasts pull and they are symmetrical in that pull. And then I would also go ahead and assess your epitrochlear lymph nodes in your axilla and make sure that your axilla isn't red. And then if those lymph nodes were present, we'd make sure that they're small, round, and movable. And then also make sure there's no pain or tenderness in either of your axillas. I would also go ahead and palpate your breasts as well, looking for any lesions or masses. And then I would also report those to the primary care provider if those were noted. And if they were noted, I'd ask you if you've noticed them before. So next, I'm going to go ahead and I'm going to assess your lower extremities. So I'm going to assess for color, for symmetry, for surface characteristics, and if there's any lesions present. And then also for intactness. and then if there's any edema. So I don't see that there's any edema present in your legs. Your legs are pink, warm, and dry. They're intact. They're smooth in texture, and they're symmetrical. And then I'd also go ahead and assess your feet as well, and the cap refill of all of your toes, and those are within 3 seconds. And then I would also go ahead and palpate. So I'm going to palpate your knees for contour, and then I'm also going to palpate your pulses. So I'm going to palpate your popliteal, which is right behind your knee, on both sides, and those are both +2. I'm going to go ahead and assess your posterior tibial on both sides, and then I'm also going to assess your dorsal pedis, which is on your feet, and all of those pulses are +2, which is an expected finding. And then next, I'm going to go ahead and assess your hips for contour as well as symmetry. So I'm going to go ahead and assess your hips, and they are symmetrical. And then next, I'm going to do range of motion of your lower extremities. So what I'm going to have you do is I'm going to have you go ahead and lay down. And then what I'm going to have you do is I'm going to have you go ahead and flex your leg. And I'll have you extend your leg. And then the other side, flex your leg and extend your leg. And then for your left leg, I'm going to have you pull it out this way. So abduct and then pull it back in. Adduct. And then I would have you do that with the other side as well. And then I'm going to have you go ahead and stand up. And then, or not stand up, I'm sorry. Sit up. I meant sit up. I'm sorry. And then we're also going to do the same thing with your feet. So I'm going to have you flex up and then extend down. And then the other foot, so flex your foot up and then extend it down. All right, and then I'm going to have you abduct. That's okay. Abduct your foot out, and then adduct it in, and then abduct your foot out, and then abduct it in. Perfect. And then can I have you rotate? All right, and then your other foot, rotate. Perfect. All right, so next I'm going to go ahead and measure the circumference of your thighs as well as your calves, and they should be of equal size. So I'm going to go ahead and find the largest part of your thigh. And I'm going to go ahead and measure that. And that one is 19. And that is centimeters. And then I'm going to measure at the same part of your leg. Wait a second. No, that's not 19. Hold on. Try this
Get the
again.
right side, right side.
Yeah, make sure I have that.
Yeah. Oh, I see. Here's a 10-inch. What? No, let's try the other side of the. Oh, no.
All right, so I have 49 and a half centimeters. And then I have 49 and a half on the other side, so those are symmetrical. And then I'm going to measure at the largest part of your calf. And that is at 40. And that one is also at 40. So both your calves as well as your thighs are symmetrical. I'm going to inspect the muscle tone as well as your muscle strength of your lower extremities. So what I'm going to have you do is I'm going to put my hand on your shin, and I'm going to have you push against it. All right, other side. And then I'm going to have you pull back, and pull back. All right, and then I'm going to have you push up with your feet, and then push up. And then I'm going to have you lift your feet up a little bit. You push down, and then push down. Awesome. All right, and then you have strong strength in both legs. Next, I'm going to go ahead and test the sensory function of your legs. So I'm going to start with soft touch, and I want you to tell me if you feel it and where you feel it at. So I'm going to close your eyes.
Lower knee,
On which leg?
on the left leg.
Okay.
Right foot, left foot,
All right, and now I'm going to do point location. So I want you to tell me where I'm touching with my finger.
knee,
Which knee?
oh, I'm sorry, right knee, left thigh, thigh, a right foot,
All right, next I'm going to do sharp and dull sensations on your legs. So I want you to close your eyes, and then I want you to tell me if you feel sharp or dull.
dull, sharp, dull, dull.
Okay? And then next we're going to do 2-point discrimination. So I want you to tell me if you can feel 2 or 1.
Through my pant legs.
Yeah.
2, 1, 2, 1, 2, 1.
All right. And next we're going to do extinction. So I want you to tell me when you feel, so you go from 2 down to 1. You're feeling 2 points and then down to 1 point.
Gotcha. 2, 1, 1.
Okay.
Oh, 2, 1, 1.
Okay. And then next I'm going to do vibration. So I'm going to take my tuning fork and I'm going to put it on your knee, and I want you to tell me if you can feel the vibration. So maybe close your eyes.
Yes, I feel it.
All right. And then the other one.
Yes.
Perfect. Alrighty. So next I'm going to go ahead and have you stand up. And I'm going to test your coordination.
Can't see.
Well, just move this closer. Okay. So I'm going to have you take a couple steps towards me. And then take a couple steps back. Alright. So her gait, it is symmetrical. And she has appropriate balance for her gait. And then next I'm going to have you turn around and I'm going to assess your spine. So I'm going to assess her cervical, thoracic, and lumbar spine. And they are midline with her back. And then I'm also going to go ahead and palpate each of her vertebrae for any masses or lesions present. Alright, and I don't feel any. And I'm going to assess her hips for symmetry, and they are symmetrical. And then I can have you go ahead and face towards me. And then I'm going to go ahead and test your balance. So this is called the Rimberg test. And what I'm going to have you do is I'm going to have you close your eyes and just stand there. Alright, perfect. You can go ahead and open your eyes. So that tests for if you have any swaying, but the expected finding is to stand where you are, which you did. And then next I'm going to have you do heel-toe walking. So this is also testing for coordination. So what I'm going to have you do is I'm going to have you walk heel-toe a couple steps. And then I want you to look up.
Try to go this way.
It doesn't matter.
I'm drunk.
Alright, so I'm going to go ahead and test the range of motion of your spine. So what I'm going to have you do is I'm going to have you bend over and touch your toes. Perfect. So you have full range of motion of your spine. So next I'm going to go ahead and assess your reflexes. So I'm going to start with your patellar reflexes. So go ahead and relax your body as much as you can. I'm going to go ahead and assess your reflexes. And they're strong in both of those. And next I'm going to go ahead and assess your Achilles. So I'm going to go ahead and hold your foot and tap. Hold your foot and tap. And then next I'm going to assess your plantar reflex. So I'm going to take the bottom of my hammer and I'm going to rub it on your foot from heel to toe. And an expected finding would be that your toes would curl. But if you were an infant, your toes would spread. All right, and then your final reflex I'm going to test is your ankylosing. So what I'm going to do is I'm going to go ahead and hold your foot up. All right, and the other side. And then your foot automatically slowly. Comparison of a 20 to 30-year-old to my patient who is 74. I'm going to first start with vitals. So for a 20 to 30-year-old patient, the blood pressure should be, on average, 120 over 80, and an average respiration rate should be 12 to 20 respirations per minute. An average heart rate should be 60 to 100 beats per minute. An average temperature should be 97 to 99. And an average oxygen saturation should be 95 to 100. For my patient who is 74, her blood pressure was 118 over 60, her heart rate was 72, and her respiration rate was 14, and while her oxygen was 97%, and her temperature was 99.2, which is not uncommon for older adults to have higher temperatures. And all of her vitals were very comparable to someone who is 20 to 30 years old. Next, for the skull, head, and face. So for someone who is 20 to 30, their skull should be normal cephalic, as well as symmetrical. It should have even hair distribution across the skull, which would be the hair on their head, as well as their eyebrows and eyelashes. And they should have appropriate facial expressions. For my patient, she had a normal cephalic skull, which upon palpation, she did not have any lesions or any bumps or anything. And then her hair was equally distributed across her head. However, she did have some thinning in her hair, which is not uncommon for someone who is an older adult, as someone who's 20 to 30 may have thick hair like I do. And someone who's 20 to 30 will also have like a fuller face like I do, while someone like my patient who is 74, she had thinning in her face, so she had sagging skin, which my skin is very taut. As we age, our skin becomes less elastic, like what my patient had. And then she also had hollow cheeks, so as my cheeks are filled out for a 20 to 30 year old, she had hollow cheeks where there was less subcutaneous tissue there for that elasticity. And then they should have no facial droop or edema in their face, which my patient did not have any facial droop or edema. To 30-year-old, their skin should be pink, warm, and dry. They should have equal color distribution across their body that is appropriate for their ethnicity. And they will also have warm skin with no lesions, rashes, or bruising. And then they will also have elastic skin turgor. So for my patient, she did have elastic skin turgor. However, her skin was thin compared to my skin, which would be thicker, and it would have more elasticity to it because there's more subcutaneous fat present. And she also had, her skin was pink, warm, and dry. It was drier than what my skin would be, and that is a common finding for older adults. And she had less elasticity in her eyes. So eyesight should be 20/20 for both distant as well as near vision. And their peripheral vision should be, they should have full peripheral vision. For my patient, she had vision in her right eye being 20/40, while having vision of 20/70 in her left eye, as she's legally blind in that eye. And she also had diminished peripheral vision. She was only able to see about 1.5 feet away from when I did the finger test. And her eyes should have perla, which they did. The pupils were reactive to light, they were equal, they were round, and they also had accommodation, which they moved equally when I put my pen light to her nose. And then she didn't have any discharge or any foreign bodies or anything present in her eyes. When I assessed her conjunctiva, it was pink, which is a common finding for both 20-year-olds as well as older adults, and there was no discharge present or anything else. 6 cardinal fields of vision, which it is, it should be intact for both the 20 to 30-year-olds, and it's common to be diminished in older adults, but she was able to follow all 6 years. A 20 to 30-year-old should have intact hearing, as well as an intact tympanic membrane that should be grayish in color as well as transparent. There should be minimal amounts of earwax, and they should have the appropriate shape, size, and position. So the position should be, the position should be at the external canthus of the eyes, and they should be symmetrical, which for my patient, this was a true finding, as well as she did not have any diminished hearing. All of her hearing was intact for all 4 tests. And I was able to see inside of her tympanic membrane. It was gray. There was a moderate amount of earwax compared to a minimal amount of earwax with a 20 to 30-year-old. For a 20 to 30-year-old, they should have patent bilateral nares, as well as nasal hairs present, and the nasal mucosa is intact. It's pink, it's moist, there's no drainage, and the nose is symmetrical. And for my patient, her nose was symmetrical, as well as nose hairs were present. There was no drainage. It was pink, moist, and intact. No foreign bodies present. And she had a strong sense of smell, which should be also in 20 to 30-year-olds. She was able to distinguish 2 different scents, and both nares were patent. 20 to 30-year-old, their mouth, their buccal mucosa should be pink, moist, and intact, with no lesions or anything present. All of their teeth should be intact, as well as their tongue is also intact, where it has a slightly textured appearance because of the taste buds, and they should have a strong sense of taste, where they're able to taste sweet, sour, bitter, and savory. And for my patient, she has all of her teeth are intact. However, her tonsils have been removed, and she could have a limited sense of taste. I just verbalized this in my assessment. I didn't actually test it. And her tongue was intact, and it was pink in appearance, and it also had that slightly rough texture as a 20 to 30-year-old would have. The hard and soft palate of a 20 to 30-year-old should be intact. And then in order to assess that, we have them open their mouth and say ah, and that palate should move. And this was also present in my patient. I also performed that test, and her palates did move, and they were intact. 20 to 30-year-old's neck, they should have full range of motion, as well as their trachea should be intact and slightly movable, as well as midline. And their thyroid, if being palpable, when they go ahead and swallow, it should not be enlarged, and it should be midline as well. And they should be able to have their carotid pulses should also be able to be palpable, and those should be +2. And they should not have any bruits present when those carotid arteries are auscultated. So for my patient, she had a full range of motion of her neck, and she had strong strength in her sternocleidomastoid mastoid, as well as her trapezius, which is a common finding for a 20 to 30-year-old as well. And then her lymph nodes were non-palpable, but if they were palpable, we'd want them to be small. And then her thyroid also moves. It is midline when I assessed that, and it was not enlarged. And then her carotid pulses were both +2, and her trachea was midline, and it was slightly movable. Did not have any bruits present in either of her carotid arteries. For upper extremities, they should be symmetrical in both strength and muscle mass, as well as have a full range of motion, and strong pulses and 2+ reflexes. So they should have a +2 in all pulses, as well as +2 in all reflexes. And my patient had full range of motion in both of her upper extremities. She had +2 pulses in all of her pulses, as well as her reflexes were all +2 as well. They should also, a 20 to 30-year-old should also have intact sensations to light touch, 2-point discrimination, point location, sharp and dull sensations, extinction, graphesthesia, as well as sternosis. For my patient, she did have diminished sensation for 2-point discrimination. She struggled to tell the difference between having 2 points or 1 point present. Extinction, she was unable to tell me when the 2 points became 1, as she reported it only being 1 point when I started. And sharp and dull sensation, she struggled to tell me the difference between sharp and dull sensation on bilateral sides. But she had intact sensation for the sternosis as well as the graphesthesia, and her light sensation was also diminished. She had strong strength in both extremities as well as strong muscle definition. However, it was slightly diminished, which is very common for older adults as they lose muscle mass as we age. For a 20 to 30-year-old interior chest, it should have symmetrical chest expansion, unlabored breathing with a regular respiratory rate, and also have clear breath sounds with no signs of rhonchi, wheezing, or rales upon auscultation in all 6 lobes of the lungs. She had clear breath sounds in all 6 lobes with no signs of rales, rhonchi, or wheezing. And she also had symmetrical chest expansion on her anterior and posterior thoracic, it's not thoracic, thorax, and she had unlabored breathing. For cardiovascular, upon auscultation for a 20 to 30-year-old, S1 and S2 sounds should be auscultated, as well as having a regular rate and rhythm with no murmurs or flutters. And for my patient who recently had a heart attack this summer, she also had S1 and S2 heart sounds, as well as a regular rate and rhythm with no murmurs or flutters. And she didn't have any peripheral edema present on any of her extremities, which would also be a common finding for a 20 to 30-year-old. Patient's lower extremities, there should be no edema present for a 20 to 30-year-old, as well as they should be able to have full sensation of the light touch, point discrimination, 2-point discrimination, point location, as well as have full strength, strong strength of both lower extremities bilaterally. For my patient, she had full strength of her lower extremities bilaterally. However, her gait was staggered as she has trouble walking because of the shape of her feet. She says she has flat feet, as well as she also had diminished light touch, 2-point discrimination, extinction, point location, or sensory reflexes, as she was not, and sharp and dull sensation, as she was not able to distinguish those as well. And she had +2 reflexes in bilateral lower extremities, and +2 pulses in bilateral extremities, bilateral lower extremities upon palpation.